The fluorescent lights hummed their familiar tune across the empty corridors of Metropolitan General Hospital as Marcus Chen pushed his cleaning cart through the emergency department. The wheels squeaked softly against the polished linoleum, a sound that had become as natural to him as breathing over the past 3 years. At 38, his hands moved with a precision that seemed almost surgical as he wiped down surfaces, his dark eyes taking in details that most people would miss. The emergency room held a different energy at 2 in the morning. Gone were the frantic voices and rushing footsteps of the day shift. Instead, a skeleton crew of nurses and residents moved through their routines with the quiet efficiency of those who had learned to find rhythm in chaos. Marcus appreciated these hours. They gave him space to think, to observe, and most importantly, to remain invisible. Dr. Sarah Martinez emerged from Trauma Bay 3, pulling off her surgical gloves with the practiced motion of someone who had done this thousands of times despite being only 29. Her scrubs were splattered with blood, but her expression held the satisfied exhaustion of someone who had just won a battle. She glanced toward Marcus as he methodically cleaned the nearby workstation, and something in her gaze lingered longer than usual. Marcus had noticed Dr. Martinez before. Unlike many of the other doctors who treated hospital staff like furniture, she always nodded when she passed him in the hallways. Tonight, though, there was something different in the way she watched him work. Her brown eyes held a curiosity that made him slightly uncomfortable. He turned his attention back to his work, spraying disinfectant across the counter with measured strokes. The familiar chemical smell filled the air, mixing with the underlying hospital sense of antiseptic and floor wax that had become the backdrop of his life. Through the large windows overlooking the parking lot, he could see the first hints of dawn beginning to touch the horizon. In a few hours, he would drive home to his small apartment where 80-year-old Lily would be waking up for school. She would wrap her arms around his neck and tell him about her dreams, and for those precious moments, the weight he carried would feel lighter. Lily was his anchor, his reason for choosing invisibility over the life he once knew. Dr. Martinez approached the nurse's station where Marcus was cleaning, her footsteps soft on the floor. She moved with the confidence of someone who belonged in this environment, yet there was something gentle in her demeanor that set her apart from the typical surgical ego he had observed over the years. A trauma alert suddenly crackled over the intercom, and the peaceful atmosphere shattered like glass. Multiple vehicle accident, 3 minutes out, all hands needed. Dr. Martinez's entire posture changed, her body shifting into the focused alertness that Marcus recognized from another time, another life. She rushed toward the trauma bays, her ponytail swaying behind her as nurses mobilized around the department. Marcus continued his cleaning, but his eyes followed the preparations with an intensity that would have surprised anyone who bothered to notice. He watched the way Dr. Martinez checked equipment, the precise movements of her hands as she prepared for whatever was coming through those doors. The ambulance sirens grew louder, and Marcus found himself gripping his cleaning rag tighter than necessary. The bracelet on his wrist caught the light, a simple silver band with a medical alert symbol that he never removed. Dr. Emily Chen, it read, along with her medical license number and emergency contact information. His wife's bracelet, the one she had worn every day during her residency, through her fellowship, right up until the day she died. Where in the world are you watching this story unfold tonight, he wondered, thinking of all the people who might be experiencing their own quiet struggles in hospitals and workplaces around the globe. What time is it where you are, and do you know someone who works these invisible hours, keeping the world clean and safe while others sleep? The ambulance bay doors burst open, and the controlled chaos of emergency medicine filled the space. Marcus stepped back into the shadows, becoming part of the background as he had trained himself to do. But his eyes never left the trauma bay where Dr. Martinez worked with steady hands and a calm voice that cut through the noise. He saw things others missed. The slight tremor in the junior resident's hands. The way one of the nurses favored her left leg, probably from standing too long. The exact angle Dr. Martinez held her scalpel, the confident way she called for instruments, the focused intensity in her eyes as she fought to save a life. These were details that came from years of training, from muscle memory that never quite faded even when buried under layers of deliberate forgetting. Marcus Chen had spent 3 years perfecting the art of being invisible, but some knowledge was harder to hide than others. As he continued his cleaning routine, moving methodically through the department like a ghost in Scrubs, Marcus caught Dr. Martinez glancing in his direction again. This time, her gaze dropped to his wrist, to the bracelet that he suddenly realized was visible beneath his uniform sleeve. For just a moment, their eyes met across the busy emergency room. In that instant, Marcus saw something flicker in her expression, a recognition that made his breath catch in his throat. It was the same look he had once seen in the eyes of fellow doctors when they encountered someone who understood their world from the inside. He quickly turned away, focusing on his cart and the familiar rhythm of his work. But the feeling lingered, the uncomfortable sensation of being seen when he had worked so hard to remain hidden. The night shift was supposed to be his sanctuary, the place where Marcus Chen the janitor could exist without questions or complications. As the trauma patient was stabilized and wheeled toward surgery, the emergency department began to settle back into its quieter rhythm. Dr. Martinez removed her gloves and washed her hands at the nearby sink, the practiced ritual of someone who understood the sacred nature of clean hands in medicine. She walked past Marcus as he cleaned the adjacent hallway, and this time she stopped. Her voice was soft when she spoke, barely above a whisper, but her words carried a weight that made Marcus's chest tighten. "Thank you," she said simply, and when he looked up in confusion, she gestured toward the trauma bay. "For keeping everything so clean and ready for us. It matters more than you might think." There was something in her tone that suggested she meant more than just the cleaning, but Marcus only nodded and returned to his work. Dr. Sarah Martinez continued down the hallway, leaving behind the faint scent of surgical soap and something else, something that reminded Marcus of the doctor he used to be. The rest of his shift passed without incident, but Marcus found himself thinking about that moment, about the way Dr. Martinez had looked at him, about the uncomfortable feeling that his carefully constructed invisibility might not be as complete as he had believed. As he prepared to leave at 6 in the morning, Marcus caught sight of his reflection in the glass doors leading to the parking lot. The man looking back at him wore the uniform of a hospital janitor, but for just a moment, he could see traces of the person he used to be. The precision in his movements, the way he held himself, the knowledge that lived behind his eyes despite all his efforts to bury it. He thought of Lily, probably just waking up in her small bed, and the promise he had made to himself to give her a stable, quiet life. No more deployments, no more trauma surgery, no more nights when he came home covered in other people's blood and unable to sleep. Just the simple, honest work of keeping things clean and safe. But as Marcus walked toward his car in the growing morning light, he couldn't shake the feeling that something had shifted during the night shift. Dr. Martinez had seen something in him, recognized something that he had tried so hard to keep buried. And that recognition scared him more than any emergency he had ever faced. The morning sun filtered through the thin curtains of Marcus's one-bedroom apartment as he quietly unlocked the front door. The familiar scent of vanilla candles and his daughter's strawberry shampoo greeted him like a warm embrace. He set his keys on the small table by the entrance, careful not to make any noise that might wake Lily before her alarm. Mrs. Rodriguez from next door had left a note on the kitchen counter, her handwriting neat and precise. Lily ate all her dinner and finished her homework. She asked 3 times when Daddy would be home. "Sweet dreams to you both." Marcus smiled despite his exhaustion. The elderly woman had become their guardian angel over the past 3 years, refusing payment but accepting the occasional grocery run or light bulb change in return. He padded softly toward Lily's room, pausing at the doorway to watch his daughter sleep. At 8 years old, she had her mother's delicate features and dark hair that fell in waves across her pillow. Her breathing was steady and peaceful, one small hand clutching the stuffed elephant that had been her constant companion since she was 3. The walls of her room were covered with her artwork, colorful drawings of houses with smoke curling from chimneys, stick figures holding hands under rainbow skies, and her latest masterpiece, a detailed sketch of a hospital that she had titled Daddy's Work in careful block letters. She had captured details that surprised him, the emergency room layout accurate enough to make him wonder how much she really understood about his life. Marcus settled into the small chair beside her bed, the same chair where he read to her every morning when he came home from work. Today's book lay open on her nightstand, a story about a little girl who wanted to be a doctor. Lily had been asking more questions lately about hospitals and medicine, curiosity sparked by his work environment and the medical shows she sometimes watched with Mrs. Rodriguez. His wrist ached slightly, and he glanced down at the bracelet that had caught Dr. Martinez's attention. Emily's bracelet. His wife had worn it during her surgical residency, a simple silver band that identified her as Dr. Emily Chen, trauma surgeon. After she died, Marcus had taken to wearing it, a small connection to the woman who had believed he could be more than he thought possible. The irony wasn't lost on him. Emily had encouraged his medical school applications, supported him through the grueling years of training, celebrated when he matched into his surgical residency. She had been so proud when he deployed as a combat medic, even though it meant leaving her alone with a newborn Lily. She never knew that the same skills she had admired would become the source of his nightmares. Lily stirred in her sleep, and Marcus reached out to smooth her hair. She opened her eyes slowly, blinking in the soft morning light before focusing on his face. Her smile was immediate and radiant, the kind of pure joy that made every difficult night worth enduring. "Daddy," she whispered, her voice still thick with sleep. "You're home." He leaned down to kiss her forehead, breathing in the sweet scent of her hair. "I'm home, baby. Did you sleep well?" She nodded, sitting up and wrapping her arms around his neck with the fierce affection that only children possessed. "I dreamed about you again. You were helping people, but you weren't cleaning. You had on different clothes, like the doctors on TV." Marcus felt his chest tighten. Lily's dreams had been increasingly vivid lately, filled with images of him in medical scrubs rather than janitorial uniforms. He wondered if children possessed some intuitive understanding that adults lost along the way, an ability to see past the surface to the person underneath. "Tell me about your dream," he said, settling back in the chair as she arranged herself more comfortably in bed. "You were in the hospital, but in the special rooms where they fix people who are really hurt. And there was a nice lady doctor with pretty brown hair who kept looking at you like she knew a secret. She had kind eyes, Daddy. The kind that see things other people miss." The description sent a chill through Marcus. Lily had never met Dr. Martinez, had never even visited his workplace, yet her dream captured details that felt impossibly accurate. He struggled to keep his expression neutral as she continued. "In the dream, you saved someone who was very sick. And the lady doctor, she smiled at you like Mommy used to smile when she was proud. Like she knew you were special even when you were trying to hide it." Marcus pulled Lily closer, his throat tight with emotion. "Sometimes dreams are just our minds playing with ideas, sweetheart. They don't always mean something real." But Lily looked at him with the serious expression she wore when she was thinking deeply about something important. "Maybe dreams are how we remember who we're supposed to be," she said with the simple wisdom that children sometimes possessed. "Maybe they're reminders of the good we can do when we're not afraid." Her words hung in the air between them, profound in their innocence. Marcus had spent 3 years teaching himself to be afraid, to stay small and hidden and safe. But looking into his daughter's eyes, he wondered if his careful invisibility was protecting her or limiting her understanding of what was possible. The alarm clock began its gentle chiming, signaling the start of Lily's school day. She groaned dramatically and burrowed deeper into her covers, a morning ritual that never failed to make Marcus smile. The normal routine of breakfast and backpack preparation helped ground him after the intensity of their conversation. As he helped her brush her teeth and choose clothes for school, Marcus found himself thinking about Dr. Martinez's words from the night before. "Thank you for keeping everything so clean and ready for us. It matters more than you might think." There had been something in her tone, a recognition that suggested she saw beyond his janitor's uniform to something deeper. Lily chattered about her upcoming science project as they sat at the small kitchen table, sharing toast and orange juice in the morning light. She wanted to build a model of the human heart, complete with chambers and valves that she could explain to her classmates. Her enthusiasm for the subject was infectious, and Marcus found himself drawn into technical discussions that revealed more of his medical knowledge than he usually allowed. When it was time to walk her to school, Lily slipped her small hand into his as they made their way down the apartment complex stairs. She had inherited her mother's curiosity and his careful attention to detail, a combination that made her both delightful and occasionally concerning as a conversation partner. At the school entrance, she hugged him goodbye with the same fierce affection she had shown that morning. As she ran toward her classroom, her backpack bouncing with each step, Marcus felt the familiar mixture of pride and protective worry that defined his existence as a single father. Driving home through the morning traffic, he couldn't shake the memory of Dr. Martinez's curious gaze or Lily's eerily accurate dream. For 3 years, he had successfully maintained the separation between Marcus the janitor and the doctor he used to be. But something was shifting, and he wasn't sure he could control it much longer. Back in his apartment, as he prepared for the few hours of sleep that would sustain him through another night shift, Marcus caught sight of his reflection in the bathroom mirror. The man looking back at him wore the tired expression of someone carrying more weight than was visible on the surface. He thought about Lily's words, about dreams as reminders of who we're supposed to be. And for the first time in 3 years, Marcus Chen allowed himself to wonder if his daughter might be wiser than her father about the difference between hiding and healing. 3 nights later, Marcus returned to his shift with the memory of Lily's dream still echoing in his mind. The emergency department buzzed with its usual controlled chaos, but tonight felt different somehow. Dr. Martinez was working another late shift, and Marcus found himself more aware of her presence than he cared to admit. He began his cleaning routine in the nurse's station, methodically wiping down surfaces while listening to the familiar symphony of medical equipment and hushed conversations. The night supervisor, Janet, barely glanced up from her paperwork as he worked around her desk. After 3 years, he had perfected the art of being functionally invisible to most staff members. Dr. Martinez emerged from examination room 4, pulling off her stethoscope with the fluid motion of someone who had performed the action thousands of times. She paused at the nurse's station to update a chart, her pen moving quickly across the pages in neat, precise handwriting. Marcus noticed the way she held her pen, the slight callus on her middle finger from years of writing detailed notes. As he cleaned the nearby medication cart, Marcus couldn't help but observe her work. She had a patient with chest pain, and he watched her systematic approach to the examination. Her questions were thorough but gentle, her hands confident as she palpated for signs of distress. There was something in her technique that reminded him of the best doctors he had worked with during his residency, a combination of clinical skill and genuine compassion. The automatic doors to the ambulance bay suddenly burst open, and paramedics rushed in with a trauma patient. Motorcycle accident, the lead medic called out, multi-system injuries, possible internal bleeding. The controlled atmosphere of the emergency room shifted instantly into high gear. Marcus stepped back against the wall, making room for the rushing medical team, but his eyes remained fixed on the unfolding scene. Dr. Martinez moved with practiced efficiency, calling out orders as nurses mobilized around the trauma bay. Her voice remained calm and clear despite the urgency of the situation. Dr. Richard Hawthorne, the department chief, appeared from his office with the commanding presence of someone accustomed to being the ultimate authority. At 55, he carried himself with the arrogance that came from decades of successful surgeries and department politics. His gray hair was perfectly styled, and his expensive watch caught the fluorescent lights as he moved. "What do we have, Martinez?" he said, his tone suggesting that her preliminary assessment was merely a starting point for his superior judgment. 23-year-old male, motorcycle versus SUV, Dr. Martinez replied without taking her eyes off the patient. "Possible splenic laceration, definite fractured ribs, and I'm concerned about a pneumothorax on the left side." Marcus watched from his position near the wall as Dr. Hawthorne examined the patient. Something about the older doctor's technique made him uncomfortable, though he couldn't immediately identify what was wrong. The examination seemed rushed, superficial, missing some of the subtle signs that Marcus had been trained to recognize. "Look straight forward to me," Dr. Hawthorne announced with the confidence of someone who rarely questioned his own assessments. "Patch him up and get him to surgery. No need to overcomplicate things, Martinez. Sometimes the obvious answer is the right answer." But Dr. Martinez frowned, her hands still on the patient's abdomen. "Sir, I think we should consider additional imaging. His blood pressure is dropping, and there's guarding in the left upper quadrant that suggests more significant internal bleeding than initially apparent." The patient's monitor began beeping more insistently, and Marcus felt his pulse quicken. From his vantage point, he could see signs that the medical team was missing. The slight color change in the patient's fingernails, the particular way his chest rose and fell, the positioning of his left arm that suggested compensatory behavior for internal pain. Dr. Hawthorne's expression hardened at what he perceived as a challenge to his authority. "Martinez, I've been doing this since you were in high school. I think I can handle a straightforward trauma case without a second-year resident second-guessing my clinical judgment." The words hung in the air like a slap, and Marcus saw Dr. Martinez's shoulders tense. But she didn't back down, her voice remaining steady despite the public humiliation. "With respect, sir, the patient's vitals are suggesting something more complex. I think we should at least consider." "That's enough," Dr. Hawthorne cut her off, his voice loud enough that several nurses turned to look. "You'll do as I've instructed, or perhaps you need to reconsider whether you're suited for emergency medicine. Some people are simply too cautious to handle the split-second decisions this specialty requires." Marcus gripped his cleaning rag tighter, fighting the urge to step forward. Every instinct he possessed was screaming that Dr. Martinez was right, that the patient needed more thorough evaluation before surgery. But he was just a janitor, invisible and powerless, and any intervention would only make things worse for everyone involved. Dr. Martinez's face flushed with a combination of anger and embarrassment, but she nodded curtly and began preparing the patient for transport. Marcus could see the frustration in her movements, the way she continued to monitor vitals with the intensity of someone who knew she was being forced to provide suboptimal care. As the trauma team prepared to move the patient, Marcus found himself moving closer to the bay, ostensibly to clean the area they would soon vacate. But his real motivation was to get a better look at the patient, to confirm what his experienced eye was telling him about the severity of the injuries. The patient's left pupil was slightly more dilated than the right, a subtle sign that could indicate increased intracranial pressure. His breathing pattern showed the kind of compensation that suggested multiple system involvement. These were details that required the careful observation of someone who had seen similar cases in high-stress environments. Dr. Martinez caught sight of Marcus as she prepared to accompany the patient upstairs. For just a moment, their eyes met, and he saw something desperate in her expression. She knew she was right about the patient's condition, but she was powerless to act against Dr. Hawthorne's authority. The trauma team moved toward the elevators with their patient, Dr. Hawthorne leading the way with his characteristic confidence. Dr. Martinez followed, but she glanced back once more toward Marcus, and in that glance was a frustration that he recognized from his own past experiences with medical politics and dangerous ego. As the elevator doors closed, Marcus stood alone in the now quiet trauma bay, still holding his cleaning supplies. The room felt empty without the urgency of medical intervention, but the weight of what he had witnessed pressed down on him like a physical force. He began cleaning the trauma bay with mechanical precision, but his mind was elsewhere, calculating the patient's likely trajectory based on the symptoms he had observed. Dr. Martinez had been absolutely correct in her assessment, and Dr. Hawthorne's dismissal of her concerns would likely have serious consequences. Marcus thought about Lily's dream, about the version of himself who helped people instead of just cleaning up after their efforts. For 3 years, he had chosen silence and invisibility, but tonight felt different. Tonight, he had watched a good doctor be humiliated for providing excellent patient care, and he had done nothing to support her. The weight of Emily's bracelet on his wrist seemed heavier than usual as he finished cleaning the trauma bay. Somewhere upstairs, a young man's life hung in the balance, and Marcus Chen found himself wondering if his commitment to remaining hidden was worth the cost of his continued silence. 2 hours after the motorcycle accident victim had been taken upstairs, the emergency department received word that validated Dr. Martinez's concerns in the worst possible way. The patient had crashed during surgery, requiring emergency intervention for massive internal bleeding that Dr. Hawthorne had initially missed. The young man was now in critical condition, fighting for his life in the intensive care unit. Marcus learned this information while emptying trash cans near the nurse's station, where the night supervisor was updating the staff on the patient's deteriorating condition. Dr. Martinez sat at the desk, her head in her hands, the weight of being proven right offering no comfort when it came at such a devastating cost. She had returned from surgery an hour earlier, her scrubs unchanged but her expression carrying the hollow look of someone who had watched a preventable tragedy unfold. Dr. Hawthorne was conspicuously absent, having left for home immediately after the surgery, leaving Dr. Martinez to handle the family notification and paperwork. Marcus continued his cleaning routine, but his attention remained focused on Dr. Martinez's obvious distress. She was reviewing the patient's chart again, probably looking for something she might have missed, some way she could have been more persuasive in advocating for proper care. It was a futile exercise that Marcus recognized from his own past experience with medical regret. The automatic doors opened to admit a middle-aged woman with red-rimmed eyes, accompanied by a man who shared the patient's facial features. The victim's parents, Marcus realized, arriving for what would undoubtedly be one of the worst conversations of their lives. Dr. Martinez stood immediately, straightening her shoulders and preparing to face them with the news about their son's condition. Marcus watched from across the room as she guided the family to a private consultation area. Through the glass walls, he could see her speaking with gentle authority, her hands moving expressively as she explained the medical situation. The mother collapsed into her husband's arms, and Marcus felt a familiar tightness in his chest at the sight of parental grief. When Dr. Martinez emerged from the family meeting 20 minutes later, her professional composure finally cracked. She walked quickly toward the staff bathroom, but not before Marcus caught sight of the tears she was fighting to contain. The injustice of the situation hit him like a physical blow. She had provided excellent medical judgment, been publicly humiliated for it, and was now bearing the emotional weight of a preventable tragedy. Marcus found himself following her path down the hallway, not entirely sure what he intended to do but unable to simply continue his cleaning routine. He paused outside the staff bathroom, hearing the muffled sound of crying from within. For 3 years, he had trained himself to observe without intervening, but something about Dr. Martinez's situation pierced through his carefully constructed emotional barriers. When she emerged a few minutes later, her eyes were red but her composure was restored. She nearly collided with Marcus, who was standing uncertainly in the hallway with his cleaning cart. For a moment, they stood facing each other in the empty corridor, and Marcus saw something in her expression that made his decision for him. "Dr. Martinez," he said quietly, his voice barely above a whisper. "You were right about the patient. Your assessment was correct." She looked at him with surprise, probably wondering how a janitor would know enough about medical care to make such a judgment. But there was something in his tone, a certainty that suggested his opinion carried more weight than his position would indicate. "You saw the examination," she said, her voice hollow with exhaustion. "You were there when Dr. Hawthorne dismissed my concerns." Marcus nodded, choosing his words carefully. The patient showed signs of complex trauma that required more thorough evaluation. "Your clinical instincts were sound. What happened wasn't your fault." Dr. Martinez studied his face with growing curiosity. There was something in his language, the precise medical terminology and confident assessment, that didn't match his janitor's uniform. "How do you know about medical assessments?" she asked softly. Marcus felt the familiar panic of being seen too clearly, of having his carefully maintained invisibility threatened by his own inability to remain silent in the face of injustice. But looking at Dr. Martinez's tear-stained face, he found himself unable to retreat completely behind his usual deflections. "I've seen a lot of trauma cases over the years," he said, which was true enough without revealing the context of his experience. "Sometimes you learn to recognize the signs when someone's medical judgment is being compromised by politics rather than patient care." The answer seemed to satisfy her immediate curiosity, but Marcus could see that she was filing away the information for future consideration. Dr. Martinez was clearly intelligent and observant, and his intervention tonight had probably raised more questions than it answered. "Thank you," she said finally, her voice thick with emotion. "It helps to know that someone else saw what I saw." Sometimes in this place, you start to question your own instincts when they conflict with the hierarchy. Marcus understood that feeling more deeply than she could know. The military medical system had its own version of dangerous hierarchy, where junior doctors learned to suppress their clinical judgment in deference to ranking officers who might be wrong. He had seen good doctors make terrible decisions because they were afraid to challenge authority, and he had learned the devastating cost of institutional silence. You should trust your instincts, he told her with quiet conviction. Good doctors develop clinical intuition for a reason. Don't let anyone make you doubt what you know to be true about patient care. Dr. Martinez looked at him with an expression that was becoming increasingly familiar, a mixture of curiosity and recognition that made Marcus deeply uncomfortable. There was something about his words, his confidence in discussing medical judgment, that didn't align with his supposed background as a hospital janitor. The emergency department's overhead page system crackled to life, calling Dr. Martinez back to the treatment area for a new patient arrival. She glanced toward the sound, then back at Marcus with obvious reluctance to end their conversation. I should go, she said, but her tone suggested she would have preferred to continue exploring the mystery of the janitor who spoke like a doctor. Thank you for listening. And for understanding what happened tonight. Marcus nodded and stepped back to allow her to pass, but as she walked away, he caught her glancing back once more with that same penetrating curiosity that had begun to characterize their interactions. He had revealed too much of himself tonight, allowed his medical knowledge and emotional investment to show through his carefully constructed facade. As he returned to his cleaning cart, Marcus realized that his conversation with Dr. Martinez had crossed a line that would be difficult to uncross. She was beginning to see through his invisibility, and that recognition carried risks that extended far beyond his own comfort. His quiet life with Lily depended on maintaining the separation between his past and present identities. But as he resumed his cleaning routine, Marcus found himself thinking about the motorcycle accident victim fighting for his life upstairs, about Dr. Martinez bearing the emotional weight of institutional failure, and about his daughter's dreams of a father who helped people instead of hiding from them. For the first time in 3 years, Marcus Chen wondered if his commitment to invisibility was protecting his family or preventing him from becoming the person his daughter believed him to be. The question followed him through the rest of his shift, persistent and uncomfortable, like a surgical instrument left behind after an operation. The following evening brought an unexpected shift in the hospital's atmosphere. Word had spread about the motorcycle accident and Dr. Hawthorne's misdiagnosis, creating tension that rippled through every department. Marcus arrived for his night shift to find the emergency room staff walking on eggshells, their usual casual efficiency replaced by careful documentation and second-guessing. Dr. Martinez was already there when Marcus began his rounds, but something had changed in her demeanor overnight. Where yesterday she had been devastated by the preventable tragedy, tonight she carried herself with a quiet determination that reminded Marcus of soldiers he had known who had decided to fight battles they knew they might lose. She was reviewing charts at the nurse's station when Dr. Hawthorne made his entrance, arriving with the theatrical flair of someone who believed his presence improved any situation. His expensive suit was perfectly pressed, and he carried himself with the arrogance of a man who had never faced meaningful consequences for his mistakes. Marcus positioned himself near the medication supply area, close enough to observe but far enough away to maintain his invisibility. He had learned the art of productive eavesdropping during his years in military hospitals, where information often meant the difference between life and death. Martinez, Dr. Hawthorne called out, his voice carrying the false joviality of someone attempting to control a narrative. I trust you've learned something valuable from yesterday's case. Sometimes experience teaches us lessons that textbooks cannot provide. The implication was clear and insulting. Dr. Hawthorne was attempting to reframe his dangerous incompetence as a teaching moment, making Dr. Martinez somehow responsible for the patient's deteriorating condition. Marcus felt his jaw clench as he watched the older doctor's manipulative performance. Dr. Martinez looked up from her charts with the steady gaze of someone who had made a difficult decision during the sleepless hours between shifts. Actually, Dr. Hawthorne, I believe yesterday's case demonstrated the importance of thorough evaluation over hasty conclusions. The patient's current critical condition validates the concerns I raised during our initial assessment. The challenge was delivered with professional courtesy, but there was steel beneath her polite words. Marcus recognized the tone from his own military experience, the careful formality that preceded either promotion or court-martial depending on how authority figures responded to legitimate criticism. Dr. Hawthorne's expression darkened at what he perceived as insubordination. His voice dropped to a dangerous whisper that somehow carried further than shouting would have. "Dr. Martinez, I think you're confusing hindsight with foresight. Second-guessing attending physicians is not the same as providing superior medical care." "With respect, sir," Dr. Martinez replied, her voice remaining steady despite the obvious threat in his tone, "my concerns were based on clinical observations made during the initial examination. The patient's deteriorating condition was predictable based on the symptoms we documented." Marcus found himself moving closer, ostensibly to clean nearby surfaces but actually positioning himself where he could intervene if the situation escalated beyond professional disagreement. There was something in Dr. Hawthorne's posture that suggested he was capable of more than verbal intimidation. Several nurses had stopped their work to observe the confrontation, and Marcus could see that Dr. Martinez was aware of the audience. She was taking a significant professional risk by challenging Dr. Hawthorne publicly, but she seemed determined to prevent future tragedies even if it cost her career advancement. "Perhaps you need to reconsider whether emergency medicine is the right specialty for someone with your obviously delicate constitution," Dr. Hawthorne said, his words designed to cut deeply. "Some people simply lack the decisive temperament required for split-second medical decisions." The personal attack crossed a line that professional disagreement should never breach, and Marcus felt something shift inside him like a tectonic plate finding a new position. He had spent 3 years perfecting the art of remaining silent in the face of injustice, but watching Dr. Martinez face professional destruction for providing excellent medical care triggered something deeper than his commitment to invisibility. "What part of this story resonates most with you?" he wondered, thinking of people around the world who had faced similar moments when they had to choose between safety and principle. "Have you ever watched someone take a stand for what's right even when it put their livelihood at risk? Sometimes the most important battles are fought by people who have everything to lose." Dr. Martinez straightened her shoulders and met Dr. Hawthorne's gaze directly. "My temperament allows me to prioritize patient welfare over departmental politics. I believe that's exactly what emergency medicine requires." The words hung in the air like a gauntlet thrown down in medieval combat. Dr. Hawthorne's face flushed red with anger at the implicit accusation that his medical decisions were influenced by anything other than clinical judgment. Marcus could see that the situation was escalating beyond professional disagreement into personal warfare. "You're walking a very dangerous line, Martinez," Dr. Hawthorne said, his voice barely controlled. "I suggest you remember who writes your performance evaluations and recommends residents for fellowship programs. Your future in medicine depends on learning appropriate respect for experience and authority." The threat was explicit and devastating. Dr. Hawthorne was using his institutional power to silence legitimate medical criticism, exactly the kind of toxic hierarchy that Marcus had fled when he left military medicine. But Dr. Martinez didn't back down, even knowing the cost of her defiance. "My future in medicine depends on providing the best possible patient care," she replied with quiet dignity. "I won't compromise that responsibility to preserve anyone's ego, including my own." Marcus felt a surge of admiration for her courage that was quickly followed by protective concern for her career. Dr. Hawthorne had the power to destroy her professional prospects, and his expression suggested he was seriously considering doing exactly that. The injustice of the situation activated every protective instinct Marcus had developed during his years as a combat medic. Dr. Hawthorne stepped closer to Dr. Martinez, using his physical presence to intimidate her in a way that made Marcus's hands tighten around his cleaning supplies. The older doctor's voice dropped to a whisper that was somehow more threatening than shouting would have been. "You have no idea what you're risking with this attitude," he said, his words carrying implications that extended far beyond professional consequences. "I suggest you reconsider your approach before you find yourself looking for a new career entirely." The implicit threat of violence in his tone crossed every line of professional conduct, and Marcus found himself taking a step forward before consciously deciding to move. His military training had taught him to recognize escalating aggression, and Dr. Hawthorne's behavior was moving into dangerous territory. But before Marcus could intervene, Dr. Martinez proved that her courage extended beyond medical advocacy. She stood her ground despite being physically outmatched, her voice carrying the authority of someone who refused to be intimidated by bullying tactics. "Are you threatening me, Dr. Hawthorne?" she asked loudly enough for the entire nursing staff to hear clearly. "Because if you are, I think we should continue this conversation with hospital administration present to ensure proper documentation." The public nature of her challenge forced Dr. Hawthorne to step back, literally and figuratively, from the line he had been approaching. His face was flushed with anger, but he was aware that his behavior was being witnessed by staff members who could testify about his unprofessional conduct. Marcus remained frozen in position, caught between admiration for Dr. Martinez's courage and fear for her safety. Dr. Hawthorne's retreat was strategic rather than genuine, and Marcus could see the calculating look in the older doctor's eyes as he processed Dr. Martinez's public challenge. The department chief was clearly weighing his options, searching for a way to retaliate that wouldn't expose him to formal disciplinary action. "I think we should table this discussion for now," Dr. Hawthorne said with forced calm, his voice carrying the deceptive reasonableness of someone planning revenge. "But Dr. Martinez, I suggest you use this time to reflect on the importance of teamwork and professional hierarchy in medical practice." The threat was thinly veiled, and everyone present understood that Dr. Martinez had just painted a target on her professional back. As Dr. Hawthorne walked away, his expensive shoes clicking against the polished floor, Marcus saw several nurses exchange worried glances. Dr. Martinez had won the immediate confrontation, but the war was far from over. Marcus resumed his cleaning routine, but his attention remained focused on Dr. Martinez's obvious tension. She was reviewing charts with mechanical precision, but her hands were trembling slightly, and he could see the emotional cost of her courageous stand. Standing up to institutional bullying required a strength that few people possessed, and Marcus felt a deep respect for her integrity. The emergency department's rhythm gradually returned to normal as the immediate drama faded, but Marcus noticed that staff members were treating Dr. Martinez differently now. Some looked at her with admiration for her courage, while others seemed to view her as a dangerous liability who had unnecessarily antagonized powerful authority. The politics of institutional survival were complex and unforgiving. Dr. Martinez called for Marcus's attention about an hour after the confrontation, gesturing toward examination room 6 where she was treating an elderly patient with chest pain. "Could you clean this area when I'm finished?" she asked, but her tone suggested she wanted to speak with him privately about something more important than housekeeping. Marcus nodded and positioned his cart nearby, waiting for her to complete the examination. Through the partially open door, he could hear her gentle voice as she explained the patient's condition and treatment options. Her bedside manner was exceptional, combining medical expertise with genuine compassion in a way that made patients feel heard and cared for. When she emerged from the examination room 20 minutes later, Dr. Martinez looked exhausted but determined. She approached Marcus with the careful demeanor of someone who had made a difficult decision during the quiet moments of patient care. "I wanted to thank you for last night," she said quietly, glancing around to ensure their conversation wouldn't be overheard. "Your support meant more than you probably realize. Sometimes in this place, you start to question whether you're crazy or everyone else is." Marcus understood that feeling intimately from his own experience with military medical politics. The gaslighting effect of institutional dysfunction could make competent doctors doubt their own clinical judgment when it conflicted with established power structures. "You're not crazy," he assured her with quiet conviction. "Your medical instincts are sound, and your advocacy for that patient was exactly what good doctors should do. Don't let anyone make you doubt your clinical capabilities." Dr. Martinez studied his face with the intense curiosity that had become characteristic of their interactions. There was something in his language and confidence that continued to puzzle her, a depth of medical understanding that seemed inconsistent with his janitorial position. "Can I ask you something?" she said, her voice dropping to a whisper. "You seem to understand medical politics and patient care in a way that's unusual for someone in your position. Have you worked in healthcare before?" The direct question sent a familiar spike of panic through Marcus's chest. Dr. Martinez was intelligent and observant, and his repeated interventions in medical situations were creating a pattern that threatened his carefully maintained invisibility. But looking into her concerned eyes, he found himself unable to retreat completely behind deflection. "I've been around hospitals for a while," he said carefully, which was true without revealing the context of his experience. "You learn to recognize good medical practice when you see it, regardless of your official role in the institution." The answer satisfied her immediate curiosity but clearly raised additional questions that she was storing for future exploration. Marcus could see that Dr. Martinez was beginning to piece together a puzzle whose solution would dramatically complicate his quiet life with Lily. Before their conversation could continue, the emergency department doors burst open to admit paramedics with a critical trauma case. "Multiple gunshot wounds," the lead medic called out, "victim of a drive-by shooting, massive blood loss, vitals dropping rapidly." Dr. Martinez immediately shifted into emergency mode, her personal concerns forgotten in the face of a patient who needed immediate intervention. But as she rushed toward the trauma bay, Marcus caught sight of Dr. Hawthorne emerging from his office with the satisfied expression of someone who had been waiting for exactly this kind of opportunity. The department chief positioned himself at the center of the trauma response, taking control of the case with his characteristic arrogance. But Marcus could see immediately that Dr. Hawthorne was more interested in reasserting his authority than providing optimal patient care. The older doctor's techniques were flashy but imprecise, designed to impress observers rather than save lives. Dr. Martinez worked efficiently around Dr. Hawthorne's grandstanding, but Marcus could see her growing concern as the patient's condition continued to deteriorate. The gunshot victim was losing blood faster than they could replace it, and Dr. Hawthorne's approach was missing critical interventions that could stabilize the situation. From his position near the trauma bay, Marcus observed details that the medical team was overlooking in their focus on the obvious injuries. The patient's breathing pattern suggested a tension pneumothorax that was compromising cardiac function. His skin color and capillary refill time indicated shock that was more severe than the visible blood loss would explain. These were subtle signs that required the experienced eye of someone who had treated similar injuries in high-stress environments. Marcus had seen countless gunshot wounds during his deployment, and he recognized the specific combination of symptoms that indicated life-threatening complications beyond the obvious trauma. Dr. Martinez seemed to sense something was wrong, but Dr. Hawthorne's domineering presence made it difficult for her to voice additional concerns. The older doctor was clearly using this case as an opportunity to demonstrate his superior authority after their earlier confrontation, and he wasn't interested in input from the resident he had already targeted for retaliation. The patient's vital signs continued to decline despite aggressive resuscitation efforts, and Marcus felt the familiar tension of watching preventable medical deterioration. Dr. Hawthorne was missing a critical diagnosis, and the patient was going to die unless someone intervened with the correct treatment. Marcus gripped his cleaning rag tighter as he watched the situation unfold, torn between his commitment to invisibility and his knowledge that could save a life. The internal tension was becoming unbearable, like trying to hold his breath underwater while watching someone drown within arm's reach. Dr. Martinez caught his eye across the trauma bay, and in that moment, Marcus saw something that made his decision for him. She knew something was wrong with the patient's treatment, but she was powerless to challenge Dr. Hawthorne's authority after their earlier confrontation. Her expression carried a desperate frustration that Marcus recognized from his own past experience with medical hierarchy and dangerous ego. The patient's monitor began alarming more insistently, and Marcus realized that time was running out for both the gunshot victim and his own commitment to remaining hidden. Some situations demanded action regardless of personal cost, and watching Dr. Martinez struggle alone against institutional dysfunction was not something he could endure in silence. The gunshot victim's blood pressure plummeted as Marcus watched Dr. Hawthorne fumble through procedures that were making the situation worse rather than better. The older doctor was so focused on maintaining his authority that he was missing obvious signs of a tension pneumothorax that was slowly crushing the patient's heart and lungs. Marcus found himself moving closer to the trauma bay, his cleaning cart forgotten as every instinct screamed at him to intervene. The patient was a young man, probably not much older than some of the soldiers Marcus had treated in field hospitals overseas. His skin had the waxy pallor that preceded cardiovascular collapse, and his breathing showed the telltale signs of respiratory compromise. Dr. Martinez was working frantically to establish additional access, but Marcus could see the frustration in her movements as she watched Dr. Hawthorne's inadequate treatment. She knew something was critically wrong, but the power dynamics of the hospital hierarchy made it impossible for her to challenge his approach after their earlier confrontation. The patient's oxygen saturation continued to drop despite aggressive ventilation, and Marcus realized that time was measured in minutes rather than hours. Dr. Hawthorne was ordering medication that would temporarily mask the symptoms without addressing the underlying mechanical problem that was killing the patient. Dr. Martinez, increase the dopamine drip, Dr. Hawthorne commanded with the false confidence of someone who was guessing rather than diagnosing. We need to support his blood pressure until we can get him to surgery. But Marcus could see that increasing cardiac stimulation would actually worsen the patient's condition by putting additional strain on a heart that was already being compressed by air trapped in the chest cavity. The treatment Dr. Hawthorne was ordering could trigger complete cardiovascular collapse within minutes. Dr. Martinez hesitated at the medication cart, her clinical instincts clearly warning her that something was fundamentally wrong with the treatment approach. But she was trapped between her medical knowledge and the institutional politics that had already put her career at risk. The patient's heart rhythm began showing signs of severe strain, and Marcus made a decision that would change everything. He stepped forward from his position near the wall, his voice cutting through the controlled chaos of the trauma bay with the quiet authority of someone who had commanded life-and-death situations. "Dr. Hawthorne," he said, his tone respectful but firm, "I think you need to consider a tension pneumothorax. The patient's tracheal deviation and jugular vein distension suggest air trapped in the pleural space that's compromising cardiac function." The trauma bay fell silent except for the sound of medical equipment and the patient's labored breathing. Every person in the room turned to stare at the janitor who had just provided a precise medical diagnosis using terminology that most nurses would struggle to articulate correctly. Dr. Hawthorne's face flushed red with anger at what he perceived as an unprecedented breach of hospital hierarchy. His voice shook with rage as he processed the audacity of a custodial worker challenging his medical authority in front of the entire trauma team. "Excuse me," he said, his words dripping with incredulous fury. "Did a janitor just attempt to provide medical advice to a board-certified emergency physician? Security needs to remove this man immediately for interfering with patient care." But Dr. Martinez was staring at Marcus with growing recognition, pieces of a puzzle finally clicking into place in her mind. The medical bracelet on his wrist, his precise understanding of clinical situations, his confident use of advanced terminology, his obvious knowledge of trauma protocols. "Wait," she said, stepping between Marcus and the security guard who was approaching. "Let him explain what he's seeing. His observations have been accurate before." The simple statement sent shockwaves through the trauma team. Dr. Martinez was publicly acknowledging that the janitor had provided previous medical insights, a revelation that challenged everything they thought they knew about hospital hierarchy and professional boundaries. Marcus felt the weight of every eye in the room, but his attention remained focused on the dying patient whose life hung in the balance. Years of military training had taught him to prioritize mission completion over personal comfort, and right now the mission was saving a life regardless of social consequences. "The patient's neck veins are distended, and his trachea is deviated to the right," Marcus explained with the calm precision of someone who had made similar diagnoses under enemy fire. "His breath sounds are absent on the left side, and his blood pressure is dropping because the trapped air is compressing his heart. He needs immediate needle decompression followed by chest tube placement." The clinical assessment was delivered with such confident authority that even Dr. Hawthorne momentarily forgot his outrage to consider the medical implications. Marcus's diagnosis explained all the symptoms that had been puzzling the trauma team, providing a coherent explanation for the patient's deteriorating condition. Dr. Martinez moved quickly to examine the patient's chest, her hands confirming the physical findings that Marcus had described. Her expression shifted from curiosity to urgent concern as she realized the accuracy of his assessment. "He's right," she announced to the room, her voice carrying the authority of someone who was no longer willing to defer to dangerous incompetence. "The patient has a massive tension pneumothorax that's causing hemodynamic compromise. We need to decompress immediately. Share your thoughts with us," Marcus found himself thinking, imagining the global audience that might be watching this moment unfold. Have you ever seen someone step forward when lives were at stake, even knowing it would cost them everything they had worked to protect? Sometimes the most important moments require us to abandon safety for the sake of others. Dr. Hawthorne stood frozen in shock as the implications of the situation crashed over him like a wave. A janitor had provided the correct diagnosis that he had missed, and worse, that diagnosis was being confirmed by the resident he had been trying to discredit. His medical authority was crumbling in front of the entire trauma team. But Marcus had no time for hospital politics when a patient was dying. He moved toward the medical supply cart with the confident stride of someone who knew exactly what needed to be done and how to do it efficiently. "Dr. Martinez, we need a 14-gauge needle and a 20-milliliter syringe for immediate decompression," he said, his voice carrying the unmistakable authority of someone who had performed this procedure countless times under the most challenging conditions imaginable. The trauma bay erupted into activity as nurses scrambled to provide the requested equipment, their training overriding their confusion about hospital hierarchy when faced with a clear medical emergency. Dr. Martinez worked alongside Marcus with the seamless coordination of two professionals who understood the critical nature of their intervention. As Marcus prepared to decompress the patient's chest, Dr. Hawthorne finally found his voice, but his words carried desperation rather than authority. "You can't let a janitor perform medical procedures," he protested weakly. "This is a violation of every protocol we have." But Dr. Martinez had made her choice, and her voice rang with the conviction of someone who was finally free to prioritize patient care over institutional politics. "Right now," she said firmly, "I'm more concerned with saving this patient's life than preserving anyone's ego or following arbitrary rules that put lives at risk." Marcus felt the familiar calm that had always descended during medical emergencies, the focused clarity that allowed him to function at his highest level when everything was at stake. His hands moved with practiced precision as he located the proper anatomical landmarks and prepared to perform the procedure that would either save the patient's life or reveal the full extent of his hidden medical background. Marcus positioned the needle with surgical precision, his hands steady despite the enormity of what he was about to reveal. Years of combat medicine had taught him that hesitation could mean the difference between life and death, and this patient's deteriorating condition left no room for doubt or delay. The trauma bay held its collective breath as Marcus inserted the needle into the patient's chest with the confident technique of someone who had performed this procedure hundreds of times under far more challenging conditions. The immediate release of pressurized air created an audible hiss that confirmed his diagnosis with devastating accuracy. The patient's vital signs began improving immediately, his blood pressure stabilizing as the compressed heart regained its ability to pump effectively. The transformation was dramatic and unmistakable, validating Marcus's intervention in a way that no amount of arguing could have accomplished. Dr. Martinez worked alongside him with seamless coordination, anticipating his needs with the intuitive understanding that developed between experienced medical professionals. She prepared the chest tube insertion kit while Marcus maintained the needle decompression, their partnership flowing with the natural rhythm of two doctors who understood trauma protocols. The nursing staff watched in stunned silence as the janitor they had barely noticed for 3 years demonstrated medical skills that exceeded those of many residents. His movements were economical and precise, each action serving a specific purpose in the systematic approach to trauma care that had clearly been ingrained through extensive training. Dr. Hawthorne stood frozen at the edge of the trauma bay, his face cycling through expressions of shock, anger, and growing comprehension. The implications of what he was witnessing extended far beyond a single medical intervention. If a janitor possessed this level of medical expertise, questions would inevitably arise about his background and qualifications. Marcus completed the needle decompression and accepted the chest tube from Dr. Martinez with a brief nod of acknowledgement. His hands moved with the confident precision of someone who had performed this procedure in field hospitals where mistakes meant soldiers died, where there was no backup and no room for error. The local anesthetic injection was administered with the gentle efficiency of someone who understood that even unconscious patients deserved careful pain management. Marcus's technique showed the kind of attention to patient comfort that distinguished truly excellent doctors from those who simply followed protocols. As he made the incision for chest tube placement, Marcus could feel the weight of every gaze in the trauma bay. Nurses, residents, and technicians watched with fascination as the quiet janitor revealed himself to be a surgeon whose skills clearly exceeded those of many attending physicians. Dr. Martinez assisted with the confident authority of someone who had finally found a medical partner worthy of her own clinical excellence. Together, they established proper chest tube placement with the kind of seamless coordination that typically took months of working together to develop. The patient's oxygen saturation climbed steadily as his compressed lung re-expanded, and his heart rhythm stabilized into a normal pattern that indicated successful intervention. The transformation from critical instability to stable condition was so dramatic that even Dr. Hawthorne could not deny the life-saving nature of Marcus's diagnosis and treatment. "Who are you?" Dr. Martinez asked quietly as they secured the chest tube, her voice filled with curiosity and growing respect. "This level of skill doesn't come from watching medical procedures. You're clearly a trained physician." Marcus felt the familiar panic of exposure, but there was also an unexpected sense of relief at having his medical identity acknowledged after 3 years of deliberate invisibility. The weight of hiding his true capabilities had been heavier than he had realized, and using his skills to save a life felt like remembering how to breathe properly. "I used to practice medicine," he said simply, his words carefully chosen to reveal truth without providing details that could complicate his quiet life with Lily. "But that was a long time ago, and I prefer my current position for personal reasons." The answer raised more questions than it answered, but Dr. Martinez seemed to understand that this was not the time or place for detailed explanations. The trauma bay was still full of medical staff who were processing the implications of what they had witnessed. Dr. Hawthorne finally found his voice, but his words carried the desperate quality of someone whose professional world was collapsing around him. "This is highly irregular," he protested weakly. "Hospital policy clearly states that only licensed physicians can perform medical procedures. This man could face criminal charges for practicing medicine without proper credentials." But his objection sounded hollow even to his own ears. Marcus had just saved a patient's life using skills that Dr. Hawthorne clearly lacked, and everyone present understood the moral implications of prioritizing bureaucracy over effective medical care. Dr. Martinez turned to face Dr. Hawthorne with the controlled anger of someone who had finally reached her limit with institutional dysfunction. "Are you seriously suggesting that we should have let this patient die rather than accept help from someone who clearly possesses superior medical knowledge?" she asked, her voice carrying the sharp edge of barely controlled fury. The question hung in the air like an indictment of everything wrong with hospital hierarchy and medical politics. Dr. Hawthorne's face flushed red as he struggled to formulate a response that would defend his position without appearing to advocate for patient deaths. Mrs. Patricia Hamilton, the hospital's chief administrator, chose that moment to arrive in the trauma bay. At 62, she carried herself with the quiet authority of someone who had spent decades navigating medical politics while maintaining focus on patient outcomes. Her presence immediately changed the dynamics of the situation. She surveyed the scene with the experienced eye of someone who could read institutional crises like weather patterns. The successfully treated patient, the obviously shaken Dr. Hawthorne, the defiant Dr. Martinez, and the janitor who was clearly far more than he appeared to be. "Would someone please explain what happened here, Mrs. Hamilton asked, her voice carrying the calm authority of someone who was accustomed to managing complicated situations with diplomatic skill. Dr. Martinez stepped forward to provide the explanation, her voice steady despite the personal and professional risks involved in supporting Marcus's intervention. This man provided the correct diagnosis that saved the patient's life when Dr. Hawthorne's treatment approach was failing. His medical knowledge and surgical skills are clearly extensive." Mrs. Hamilton's gaze settled on Marcus with penetrating intensity, and he could see her mental calculations as she processed the implications of a janitor performing successful trauma surgery. Her expression suggested that she was already several steps ahead in considering how to manage the administrative and legal complexities of the situation. The patient's improved vital signs provided undeniable evidence of successful intervention, but Marcus knew that medical success did not automatically translate to administrative approval. Hospitals operated according to complex regulations and liability concerns that often conflicted with optimal patient care. As the immediate medical crisis stabilized, Marcus realized that his 3 years of carefully maintained invisibility had ended with a single decision to save a life. There would be questions about his background, investigations into his credentials, and inevitable complications for the quiet existence he had built with Lily. But looking at the patient whose life he had just saved, Marcus found that he could not regret his choice to intervene. Some decisions transcended personal comfort, and watching someone die when he possessed the skills to prevent it was not something he could live with regardless of the consequences. The trauma bay gradually returned to its normal rhythm as the patient was stabilized for transport to surgery, but Marcus knew that everything had changed in ways that could not be undone. Mrs. Hamilton's office overlooked the hospital's main courtyard, where early morning light filtered through tall windows and cast geometric patterns across the polished conference table. Marcus sat across from the chief administrator, still wearing his janitorial uniform but carrying himself with the quiet dignity of someone who had nothing left to hide. Dr. Martinez had insisted on attending the meeting, her presence both supportive and professionally risky given her recent confrontations with Dr. Hawthorne. She sat beside Marcus with the determined expression of someone who had chosen principle over political safety and was prepared to defend that choice regardless of consequences. Mrs. Hamilton reviewed the files spread across her desk with the methodical attention of someone who understood that institutional decisions required careful consideration of multiple factors. Medical records, personnel files, and incident reports created a paper trail that would determine how the hospital responded to the previous night's unprecedented events. Mr. Chen, she began, her voice carrying the professional courtesy that masked deeper calculations about liability and institutional reputation. I've reviewed the medical records from last night's trauma case, and there's no question that your intervention saved the patient's life. However, the circumstances raise serious questions about hospital protocols and patient safety. Marcus understood the delicate position Mrs. Hamilton faced. Acknowledging his medical competence meant accepting that a janitor had outperformed an attending physician, which raised uncomfortable questions about hiring practices, credentialing procedures, and institutional oversight. But denying the effectiveness of his intervention would mean prioritizing politics over patient outcomes. I understand your concerns about protocol violations, Marcus replied carefully. But in that moment, the patient's life was more important than administrative procedures. I couldn't watch someone die when I possessed the knowledge to prevent it. Mrs. Hamilton nodded thoughtfully, her expression suggesting that she was sympathetic to his position while remaining constrained by institutional responsibilities. The hospital's legal counsel had undoubtedly briefed her on the potential liability issues surrounding unlicensed medical practice, regardless of the positive outcomes. Dr. Martinez leaned forward, her voice carrying the passionate conviction that had defined her advocacy throughout the crisis. Mrs. Hamilton, with respect, we need to consider what really happened here. A patient was dying because Dr. Hawthorne missed a critical diagnosis. Mr. Chen provided the correct assessment and performed life-saving treatment that our own attending physician was unable to provide. The statement hung in the air like an indictment of hospital hierarchy and medical competence, forcing Mrs. Hamilton to confront the uncomfortable reality that institutional authority did not always correlate with clinical expertise. The implications extended far beyond a single incident to fundamental questions about medical quality and patient safety. Mrs. Hamilton's gaze settled on Marcus with penetrating intensity, and he could see her mental calculations as she weighed the competing demands of institutional protection and medical integrity. Her next words would determine whether the hospital would embrace the lessons of the previous night or retreat into defensive bureaucracy. Mr. Chen, I need to understand your medical background, she said, her tone suggesting that evasive answers would no longer be acceptable. The level of skill you demonstrated requires extensive training and experience. Where did you complete your medical education, and why are you working as a janitor rather than practicing medicine? The direct questions pierced through Marcus's carefully maintained privacy, forcing him to choose between continued concealment and the transparency that Mrs. Hamilton clearly required. He thought of Lily, probably just waking up for school, and the promise he had made to provide her with a stable, quiet life free from the complications of his past. I completed my medical degree at Johns Hopkins and my surgical residency at Walter Reed Army Medical Center, Marcus said, the words feeling strange after 3 years of silence about his professional background. I served as a combat medic and field surgeon during multiple deployments overseas before leaving medicine for personal reasons. The revelation transformed Mrs. Hamilton's expression from skeptical curiosity to genuine surprise. Walter Reed was one of the most prestigious military medical centers in the country, and combat surgery experience represented the highest level of trauma training available. Marcus's credentials explained the exceptional skill level he had demonstrated. Dr. Martinez looked at him with growing understanding, pieces of the puzzle finally forming a complete picture in her mind. The precision of his movements, his calm under pressure, his intimate knowledge of trauma protocols, and the medical bracelet that had caught her attention all made sense in the context of military medical training. "Why did you leave medicine?" Mrs. Hamilton asked gently, her tone suggesting that she understood the answer might involve painful personal history. "And why choose to work here as a janitor rather than resume your medical practice?" Marcus felt the familiar tightness in his chest that accompanied memories of his deployment years and the events that had driven him away from medicine. The weight of Emily's bracelet on his wrist served as a reminder of everything he had lost and the life he was trying to protect for Lily. "I developed PTSD after my final deployment," he said quietly, his voice carrying the controlled emotion of someone who had learned to discuss trauma without being overwhelmed by it. "The stress of combat medicine combined with personal losses made it impossible for me to continue practicing safely. I chose to step away from medicine to focus on raising my daughter in a stable environment." The honesty of his answer seemed to resonate with Mrs. Hamilton, whose expression softened with the understanding that his janitorial work represented a deliberate choice rather than professional failure. His decision to prioritize family stability over career advancement reflected values that she clearly respected. Dr. Martinez reached over to touch his arm gently, a gesture of support that acknowledged the courage required to reveal such personal information. Her own struggles with institutional politics had given her insight into the various ways that good doctors could be driven away from medicine by systemic dysfunction. Mrs. Hamilton leaned back in her chair, her expression thoughtful as she processed the implications of Marcus's background and current situation. The hospital faced a unique opportunity to address multiple problems through creative thinking, but institutional change required careful navigation of regulatory and political obstacles. "Mr. Chen," she said finally, her voice carrying the authority of someone who had made a significant decision. "The hospital has a problem that your situation might help us address. Dr. Hawthorne's recent performance issues have raised serious concerns about patient safety and medical quality in our emergency department." The statement was carefully diplomatic, but its implications were clear. Dr. Hawthorne's pattern of poor judgment and dangerous ego had created liability risks that Mrs. Hamilton could no longer ignore. The previous night's events had provided the documentation necessary to address long-standing problems with institutional protection. Marcus felt a mixture of anticipation and concern about where Mrs. Hamilton's reasoning was leading. Her words suggested that his revelation might create opportunities rather than just complications, but institutional change was always unpredictable and often carried unintended consequences. "What are you proposing?" Dr. Martinez asked, her voice carrying the cautious hope of someone who had fought institutional dysfunction and was beginning to see possibilities for meaningful change. Mrs. Hamilton smiled with the satisfaction of someone who had found an elegant solution to multiple complex problems. "I'm proposing that we explore the possibility of Mr. Chen returning to medical practice here at Metropolitan General, where his skills could benefit our patients and his experience could help us address some of the systemic issues that last night's events highlighted." The offer hung in the air like a door opening onto possibilities that Marcus had convinced himself were permanently closed. Returning to medicine would mean confronting the trauma that had driven him away, but it would also mean using his skills to help people rather than hiding them behind the safety of invisibility. He thought of Lily's dreams about her father helping people in hospital scrubs, and her innocent wisdom about dreams being reminders of who we're supposed to be. Perhaps his daughter had been trying to tell him something that his own fear had prevented him from hearing. Marcus stared out the window of Mrs. Hamilton's office, watching the morning shift change as nurses and doctors moved through the courtyard below. The offer to return to medicine hung in the air between them, representing everything he had thought he wanted to leave behind and everything his daughter believed he could become again. "I appreciate the offer, Mrs. Hamilton," he said carefully, his voice carrying the weight of 3 years spent convincing himself that invisibility was safety. "But I'm not sure I'm ready to return to medical practice. The reasons I left haven't simply disappeared with time." Dr. Martinez leaned forward, her expression reflecting the understanding of someone who had witnessed his skill under pressure. "Marcus, what I saw last night wasn't someone who had lost his medical abilities. Your hands were steady, your judgment was flawless, and your instincts saved a life that would have been lost otherwise." Mrs. Hamilton nodded in agreement, her fingers steepled as she considered how to address his concerns while moving forward with institutional needs. "Mr. Chen, trauma affects different people in different ways, but running from our gifts rarely leads to lasting peace. Sometimes healing requires us to reclaim the parts of ourselves we've tried to bury." The word struck deeper than Marcus had expected, forcing him to confront the possibility that his 3 years of hiding had been motivated more by fear than wisdom. He thought of Lily's innocent questions about why he worked cleaning hospitals instead of helping sick people, and her dreams that seemed to see past his carefully constructed limitations. What would returning to practice actually involve, he asked, surprised to hear himself considering possibilities he had thought were permanently closed. "And what about Dr. Hawthorne? I assume my intervention last night has created complications for hospital politics." Mrs. Hamilton's expression grew more serious as she addressed the institutional realities that Marcus's revelation had created. "Dr. Hawthorne is being placed on administrative leave pending a comprehensive review of his recent medical decisions. The pattern of poor judgment and dangerous ego that you witnessed has been documented by multiple staff members over the past several months." The news that Dr. Hawthorne was finally facing consequences for his incompetence felt like vindication for Dr. Martinez, whose courage in challenging his authority had helped expose systemic problems. But Marcus could see that institutional change would create its own complications and political pressures. "As for your return to practice," Mrs. Hamilton continued, "we would need to verify your credentials and arrange for any necessary recertification requirements. But given your background and the emergency circumstances that revealed your capabilities, I believe we can expedite the process significantly." Dr. Martinez's eyes lit up with the possibility of having a medical partner whose skills matched her own dedication to patient care. The prospect of working alongside someone who prioritized medical excellence over institutional politics was clearly appealing after months of struggling against Dr. Hawthorne's dysfunction. "The emergency department needs leadership that understands both clinical excellence and trauma protocols," she said, her voice carrying the enthusiasm of someone who finally saw hope for systemic improvement. "Your military medical experience combined with your surgical training would bring exactly the kind of expertise our patients deserve." Marcus felt the familiar tension between his desire to help people and his commitment to protecting Lily from the complications of his past. Returning to medicine would mean increased visibility, potential media attention, and the risk that his military service might attract unwanted scrutiny from people who preferred his continued invisibility. But as he considered Mrs. Hamilton's offer, Marcus realized that his decision affected more than just his own life. Dr. Martinez had risked her career to support patient advocacy, and she deserved to work in an environment where medical excellence was valued over political maneuvering. "There's something else I need to consider," Marcus said quietly, his thoughts turning to the 80-year-old girl who would be coming home from school that afternoon. "I have a daughter who has built her life around the stability of our current situation. Any major change in my circumstances would affect her as well." Mrs. Hamilton's expression softened with the understanding of someone who had navigated the challenges of balancing professional responsibilities with family obligations. "Many of our physicians have children, Mr. Chen. We understand the importance of maintaining work-life balance, especially for single parents facing unique challenges." The acknowledgement of his parental responsibilities felt reassuring, but Marcus knew that Lily's needs extended beyond simple scheduling considerations. She had constructed her understanding of safety and stability around their quiet life, and dramatic changes could trigger anxiety that would be difficult for her to process. Dr. Martinez seemed to sense his internal struggle, her voice gentle as she addressed concerns that went beyond professional considerations. Marcus, children are often more resilient than we give them credit for. And sometimes they understand things about their parents that we don't see ourselves. The comment reminded Marcus of Lily's recent dreams and her innocent wisdom about dreams being reminders of who we're supposed to be. Perhaps his daughter had been trying to tell him something that his own fear had prevented him from hearing clearly. Mrs. Hamilton stood and moved to the window, her gaze settling on the emergency department entrance where ambulances delivered people in their darkest moments. The hospital's mission was fundamentally about healing and service, values that transcended institutional politics and bureaucratic complications. "Mr. Chen," she said, turning back to face him with quiet conviction, "I've been in hospital administration for over 20 years, and I've learned that the best doctors are often those who understand suffering from personal experience. Your trauma doesn't disqualify you from medicine, it gives you insight that can help other people heal." The words resonated with something deep in Marcus's chest, a recognition that his military medical experience and personal losses might actually enhance his ability to provide compassionate care rather than limiting it. Perhaps healing and helping others could be part of his own recovery process. He thought of the gunshot victim whose life he had saved, and the satisfaction he had felt at using his skills for their intended purpose after 3 years of suppression. There had been something profoundly right about that moment, a sense of alignment between his capabilities and his actions that he had not experienced since leaving medicine. "What would you need from me to move forward with this possibility?" Marcus asked, his voice carrying the cautious hope of someone who was beginning to consider that change might be growth rather than loss. Dr. Martinez smiled with the excitement of someone who finally saw possibilities for the kind of medical practice she had always wanted to be part of. "We would need to discuss your specific interests within emergency medicine, your comfort level with different types of cases, and how we can structure your return to ensure both patient safety and your personal well-being." Mrs. Hamilton returned to her desk and pulled out a folder that suggested she had already begun planning for this conversation. The first step would be credential verification and any necessary retraining or certification updates. "Given your military medical background, most of your qualifications should transfer smoothly to civilian practice." Marcus felt something shifting inside him, like a door that had been locked for 3 years finally beginning to open. The prospect of returning to medicine still carried risks and complications, but it also offered the possibility of reclaiming a part of himself that he had thought was permanently lost. He thought of Lily, and wondered how she would react to the news that her father might be able to help people in the way she had always dreamed. That evening, Marcus sat at the small kitchen table in his apartment, watching Lily work on her science project with the focused intensity that reminded him of Emily. She was constructing her model of the human heart, carefully painting the chambers in different colors while explaining the circulation process with scientific accuracy that impressed him despite his medical background. "The red blood goes from the body into the right atrium," she said, her small brush moving with precise strokes, "then to the right ventricle, then to the lungs to get oxygen, then back to the left atrium, then the left ventricle, and then out to the whole body again. It's like a perfect circle that never stops." Marcus smiled at her enthusiasm, but his mind was still processing the morning's conversation with Mrs. Hamilton and Dr. Martinez. The offer to return to medicine represented everything he had thought he wanted to avoid, but watching Lily's natural curiosity about medical science made him wonder if his fears were limiting her understanding of possibilities. "Daddy," Lily said suddenly, looking up from her project with the serious expression she wore when asking important questions, "why did you stop being a doctor?" "Mrs. Rodriguez told me that's what you used to do before I was born." The direct question caught Marcus off guard, though he realized he should have expected it eventually. Lily was 8 years old and intelligent enough to notice inconsistencies between his current work and his obvious medical knowledge. His neighbor's revelation had simply accelerated a conversation that was probably overdue. "Being a doctor was very difficult for me, sweetheart," he said carefully, choosing words that would provide honesty without overwhelming her with details about trauma and loss. "Sometimes when people help others who are very sick or hurt, it can make the helper feel sad or worried in ways that are hard to handle." Lily nodded thoughtfully, her brush paused in midair as she processed his explanation. "But you saved someone at the hospital last night, didn't you?" I could tell when you came home this morning. You looked different, like you remembered something important about yourself. Her perceptiveness startled him once again. Lily seemed to possess an intuitive understanding of emotional states that allowed her to read his moods with uncomfortable accuracy. He wondered if children naturally developed such sensitivity when they lived with parents who carried hidden pain. "How did you know about last night?" he asked, curious about how much she had pieced together from his behavior and demeanor. "You had that look you get sometimes when you're watching medical shows with me," she explained with the matter-of-fact tone of someone stating obvious facts. "Like you know what the doctors should be doing, but you're trying not to let anyone see that you know. Except last night you looked proud instead of sad." The observation was so accurate that Marcus felt exposed in a way that was both uncomfortable and oddly liberating. Lily had been watching him struggle with his hidden identity for years, and her innocent wisdom was pointing toward truths he had been avoiding. "Would you be scared if Daddy went back to being a doctor?" he asked, testing the waters for her reaction to possibilities he was still afraid to consider fully. Lily set down her brush and looked at him with the direct gaze she had inherited from her mother. "Daddy," she said with the patient tone of someone explaining something obvious to a confused adult, "I've been dreaming about you being a doctor again for months." Dreams don't usually come to little girls unless they're supposed to happen. Her words hit him like a revelation, forcing him to reconsider everything he thought he understood about her recent dreams and their apparent accuracy about Dr. Martinez and the hospital situation. Perhaps Lily's subconscious mind had been processing information and patterns that his conscious fear had prevented him from seeing. "Tell me about those dreams," he said, settling into the chair beside her with the growing realization that his daughter might understand their situation better than he did. "In the dreams, you're helping people who are really hurt, and you're not scared anymore," she said, her voice carrying the certainty of someone reporting factual information. "And there's always the nice lady doctor with brown hair who smiles at you like she knows you're special. And you wear mommy's bracelet, but instead of making you sad, it makes you strong." The detail about Emily's bracelet sent a chill through Marcus's chest. Lily's dream had captured emotional nuances about his relationship with grief and healing that he hadn't fully recognized himself. Perhaps his daughter was seeing possibilities for recovery that his own trauma had obscured. "Are you afraid of Daddy being around sick people again?" he asked, needing to understand her perspective before making any decisions that would affect their life together. Lily reached over and took his hand with the gentle affection that reminded him of Emily's touch. "Daddy," she said softly, "you're already around sick people every day at the hospital. But you're just cleaning instead of helping them get better. That makes you sad even when you try to hide it from me." The truth of her observation was so profound that Marcus felt tears gathering in his eyes. His 80-year-old daughter had identified the source of a dissatisfaction he had been suppressing for 3 years. Working in the hospital while hiding his medical abilities had been slowly eating away at his sense of purpose and self-worth. What if being a doctor again means Daddy has to work different hours, or that our life changes in ways we can't predict, he asked, still testing for concerns that might influence his decision. Lily squeezed his hand with surprising strength for such small fingers. "Changes can be good, Daddy. Remember when we moved to this apartment and I was scared, but then I met Mrs. Rodriguez and made new friends at school. Sometimes scary changes turn into the best things that ever happened." Her wisdom was delivered with the simple confidence of someone who hadn't yet learned to fear growth and possibility. Marcus realized that his efforts to protect Lily from change might actually be limiting her understanding of resilience and adaptation. The phone rang, interrupting their conversation with the electronic intrusion of the outside world. Dr. Martinez's voice came through the speaker with barely contained excitement about developments at the hospital that could affect Marcus's decision about returning to medicine. "Marcus," she said, her words rushing together with enthusiasm, "Mrs. Hamilton wanted me to call you. The medical board fast-tracked your credential review, and your military medical records confirm everything we discussed. They're prepared to offer you a position as attending physician in emergency medicine if you're interested." The news that his return to medicine could happen quickly rather than requiring months of bureaucratic processing changed the timeline of his decision dramatically. Abstract possibilities were suddenly becoming concrete opportunities that required immediate choices. Lily was watching his face with the intense attention she gave to important moments, and Marcus could see that she understood the significance of the phone call. Her expression carried expectation rather than anxiety, as if she had been waiting for exactly this kind of opportunity to present itself. "Dr. Martinez," he said, his voice carrying the weight of a decision that would change everything, "I need to discuss this with my daughter and get back to you tomorrow. But I want you to know that your support and advocacy have meant more than you probably realize." After ending the call, Marcus looked at Lily, who was smiling with the satisfied expression of someone who had watched a long-anticipated event finally unfold. Her confidence in his decision seemed absolute, as if she had never doubted that he would eventually choose to reclaim his medical identity. "If this touched your heart," he found himself thinking, "let us know where you're listening from around the world. Sometimes the people who love us most can see possibilities that our own fears prevent us from recognizing. Children often understand healing better than the adults who think they're protecting them." 6 months later, Dr. Marcus Chen walked through the emergency department of Metropolitan General Hospital with the confident stride of someone who had finally reclaimed his true identity. The medical scrubs felt natural after years of janitorial uniforms, and the weight of Emily's bracelet on his wrist had transformed from a burden of grief into a source of strength and connection. The emergency department had undergone its own transformation under his leadership as the new attending physician. Staff morale had improved dramatically with the removal of Dr. Hawthorne's toxic influence, and patient outcomes reflected the culture of medical excellence that Marcus and Dr. Martinez had worked together to establish. Dr. Sarah Martinez approached him at the nurse's station, her smile carrying the warm familiarity that had developed between them over months of professional partnership and growing personal connection. The morning's trauma cases had been handled with the seamless coordination that made difficult medicine look effortless to outside observers. The motorcycle accident patient from that first night made a full recovery, she told him, reviewing the follow-up report with satisfaction. "He's back to work and wanted me to thank you again for saving his life. His family still talks about the janitor who turned out to be the best trauma surgeon they've ever encountered." Marcus smiled at the memory of that pivotal night when his carefully constructed invisibility had finally cracked under the pressure of watching preventable tragedy unfold. The decision to reveal his medical knowledge had changed everything, but the changes had brought healing rather than the complications he had feared. The automatic doors opened to admit paramedics with a critical trauma case, and Marcus felt the familiar surge of focused energy that had always accompanied medical emergencies. A construction worker had fallen from scaffolding, suffering multiple injuries that would require the kind of systematic trauma response that had become second nature to him. As the trauma team mobilized around the patient, Marcus caught sight of Lily observing from the family waiting area where she sometimes spent time after school. At 8 years old, she was developing her own fascination with emergency medicine, asking increasingly sophisticated questions about medical procedures and patient care. She waved at him with the proud smile she wore whenever she watched him work, and Marcus felt the profound satisfaction of knowing that his daughter could finally see the person he truly was rather than the diminished version he had been hiding behind. Their relationship had deepened as his healing progressed and his sense of purpose returned. The trauma case required complex surgical intervention, and Marcus worked alongside Dr. Martinez with the intuitive coordination that had made them one of the most effective medical partnerships in the hospital. Their professional respect had gradually evolved into something deeper, though both were careful to maintain appropriate boundaries in their patient care environment. Mrs. Hamilton observed the trauma response from the administrative viewing area, her expression reflecting the satisfaction of someone whose institutional changes had produced exactly the improvements she had hoped to achieve. The emergency department's reputation for medical excellence had grown significantly under Marcus's leadership. As the patient was stabilized and prepared for surgery, Marcus removed his gloves and walked over to where Lily was waiting with the patient expression that had become characteristic of her hospital visits. She was working on homework, but her attention had been divided between math problems and medical observations. "How was school today, sweetheart?" he asked, settling into the chair beside her with the relaxed demeanor of someone whose professional and personal lives had finally achieved healthy integration. "Great," she replied, closing her textbook and giving him her full attention. "Mrs. Patterson asked me to do a presentation about what my daddy does at work, and I told the whole class about trauma surgery and how you help people who are really hurt. Tommy Miller said his dad just sells insurance, which is important too, but not as exciting. Marcus laughed at her matter-of-fact assessment of different career options, remembering his own childhood fascination with medicine and the way medical professionals had seemed like heroes to his young imagination. Lily was developing her own understanding of medicine that might someday lead her toward healthcare careers. Dr. Martinez joined them in the waiting area, having completed her post-trauma documentation with the efficiency that made her an exceptional emergency physician. Her friendship with Lily had developed naturally over the months, and she had become a trusted figure in their small family unit. "Your dad was amazing today," Dr. Martinez told Lily with genuine admiration. "The patient we just treated had injuries that could have been fatal, but your father's surgical skills and quick thinking saved his life. You should be very proud of the work he does." Lily beamed with the satisfaction of someone whose long-held beliefs had been validated by external confirmation. "I always knew Daddy was special, even when he was just cleaning the hospital. Sometimes grown-ups forget who they really are, but children remember for them." The wisdom in her words struck both adults with the force of profound truth. Marcus realized that Lily's persistent dreams and gentle guidance had been instrumental in his journey back to medicine, and that children often possessed insights that adults lost in the complexity of fear and self-protection. As the afternoon shift settled into its routine rhythm, Marcus walked Lily to the hospital's main entrance where Mrs. Rodriguez was waiting to drive her home. The elderly woman had become an extended family member whose support had made Marcus's career transition possible while maintaining Lily's stability. Before they left, Lily hugged him with the fierce affection that reminded him daily of the love that made all difficult decisions worthwhile. Her whispered words carried the simple wisdom that had guided him through his darkest period of doubt and self-imposed limitation. "I'm proud of you for remembering who you were supposed to be, Daddy," she said softly. "Mommy would be proud too. You're helping people again, and that makes your heart happy like it used to be." Marcus watched their car disappear into the evening traffic, his chest tight with gratitude for the daughter whose innocent wisdom had shown him the path back to healing and purpose. Emily's bracelet caught the light as he waved goodbye, and for the first time in years, the memory brought comfort rather than pain. Dr. Martinez appeared beside him at the hospital entrance, her presence carrying the comfortable familiarity of someone who had become essential to his professional and personal happiness. Their relationship was evolving naturally beyond medical partnership, though both were taking time to build something sustainable and healthy. "Ready for the night shift?" she asked with the smile that had first caught his attention during those early morning encounters when he was still hiding behind his janitor's uniform. "Ready," he replied, feeling the profound satisfaction of someone who had finally stopped running from his gifts and started embracing the person his family needed him to be. As they walked back into the hospital together, Marcus thought about the journey that had brought him from invisible janitor to respected physician, and the people who had believed in his worth even when he couldn't see it himself. Sometimes healing required the courage to reclaim the parts of ourselves we thought we had lost forever. If this story touched your heart and inspired you to see the hidden potential in others, please subscribe for more uplifting tales that remind us of the extraordinary people who walk among us every day. Let us know where in the world you're watching from, and remember that sometimes the most important transformations happen when we finally stop hiding our gifts and start sharing them with those who need them most. The emergency department settled into its evening rhythm, ready to face whatever challenges the night would bring, led by a team that understood that the best medicine combined technical excellence with genuine compassion for human suffering and hope.